So we were previously on surgical treatments of periodontitis, and we have in detail put some light on periodontal flap surgery, which is also known as pocket reduction surgery, where the periodontist make a tiny incision, vertical incision, which flaps open the gum tissue, and then the periodontist surgeon performs some scaling and root planning, and after that we give it a suture while keeping the tissue parallel to each other, and then after 10 to 14 days it gets healed. And then there was soft tissue grafts, where when the gum line or gums are recessed, there is gum recession. We take a part of soft tissue from palate and then graft it to cover the receding part of the gums. And then we had bone grafting in case when the bones are totally destroyed. This is very less performed procedure. And then tissue stimulating proteins, which stimulate the protein. Another technique involves applying a special gel to the diseased tooth root. This gel contains the same proteins found in developing tooth enamel and stimulates the growth of healthy bone and tissue. So this is very easy to understand. There is a gel. The gel has some tissue stimulating proteins. It is given towards the apical part, root part, and this gel, which has some proteins, are the same proteins which are present in the growing or developing tooth enamel part of the tooth. So these you see on the right side, there are some low lab grown in the petri dish, some growth factors in the petri dish, lab grown. They put in the syringe in the gel form. This syringe contain growth factors and are periodontal flap is created by a vertical incision, and then growth factors are induced to regenerate and heal the damaged tissue. Okay, now we go towards the end part. We have given enough time to this presentation, this topic, because it was important. Now let's quickly go towards the summary, and then we go to the next topic. So we already know the tooth is healthy and gums are healthy. There is no gingivitis or periodontitis. And then when the gums are inflamed, the calculus is built up, then we have gingivitis, and even calculus can harden to, plaque is built up. Plaque is built up, and then it can even harden to form calculus. Calculus is a hardening, right? And then this is known as gingivitis. And when these gingivitis further involve the surrounding tissue of periodontium, and the deep pockets are formed, these pockets more than 4 millimeter indicate moderate or mild periodontitis. And when then these pockets deepens further and there is significant or advanced bone loss, this is known as advanced periodontitis. Severe bone loss, deep pockets. Tooth is in danger of falling out because it's already loose, it's moving. And then we have very important table distinguishing gingivitis, mild periodontitis, moderate and severe periodontitis. A must know. So this is the clinical picture. Intraorally on examination, the teeth look like these. We have gingivitis, inflamed gingiva. And then mild periodontitis, as you can see, the tartar, there is tartar, there is plaque, and we have swollen gums and interdental pus if seen. Mild and then moderate, you see the tooth is already lost, and you see up to the gums have been receded a lot, and exposed, the exposed part of the teeth on the upper jaw and lower jaw, maxillomandible, both have some tartar, and the tartar and plaque is built up, definitely have bacteria, and swelling is abundant. And then we have severe periodontitis, where we can see some tooth are already lost, and the overall dentine, the position of dentine, the situation looks severe. Okay, the symptoms, how to distinguish. First, in gingivitis, we have gum bleeding, swollen gums, and bad breath. And other than that, when there is mild shaking of teeth and increased teeth sensitivity, we'll say mild periodontitis. When there is, other than these, when there is pus and fluid discharge and moderate shaking of teeth, we'll say moderate periodontitis. How you distinguish? Okay, when I ask you, okay, can you distinguish between gingivitis and different types of periodontitis? That's how you distinguish, on the basis of symptoms, on the basis of severity. If you just have gum bleeding, swollen gums, bad breath, gingivitis. If you, other than these three, if you also have mild shaking of teeth and increased teeth sensitivity, mild periodontitis. Is there, if there is pus and fluid also, fluid discharge also, and moderate shaking of teeth, then there is moderate periodontitis. And then in the severe, there is severe shaking of teeth and teeth loss and difficulty in chewing because there are no teeth. Treatments of the respective diseases, of the respective stages or conditions are: for gingivitis, we do scaling and root planning and regular dental checkup. For mild periodontitis, we do scaling, laser gum treatment. Here, moderate also laser gum treatment. With the help of laser, we remove the otherwise difficult to remove tartar and plaque. The plaque has been built up, the tartar is built up, it's difficult to remove, so we use laser gum treatment. Laser at the gums. Severe periodontitis, there is no, if the teeth are almost non-vital, non-viable, cannot be saved, we will go towards teeth extraction or teeth pulling and replacement. So this is another overview relating to the behavioral risk factors on your, depending on the patient's behavior, and environmental risk factors. When the behavior risks are absent, so we go towards, we have a healthy looking. But when there are behavioral risk factor present and environmental risk factor present, evident, then we have more severe condition. So when, what do you mean by behavior risk? Like, what is behavior? So when the patient is taking care of the teeth, there are less behavior risks, taking care of teeth, taking care of oral hygiene, visiting to the dentist, doing the dental floss, brushing the teeth, all the mouth rinse and everything. So we have a more of a clinical healthy picture. But when these risks are not there, and then there are environmental risks like chewing tobacco and smoking, and then some other comorbidities, then we have increased environmental risk, and then we can lead to the periodontitis. And then another homeostatic picture of a diseased and a healthy tissue. What's going on the healthy tissue is that biofilm homeostasis, the drugs, the healthy bacteria are there, and then homeostatic local immunity community is there. Community of immunity and biofilm by the bacteria helps the tooth surface, enamel, and dentine keep it together and healthy. And then we have healthy oral tissue, the alveolar tissue, the soft tissue, and the systemic health is up to the point where there is no problem, is healthy. And then healthy diet and antioxidant rich foods are there, so this is the healthy part. But when there is stress, we have cortisol. Cortisol will decrease the biofilm dysbiosis. Dysbiosis means bad bacteria will replace good bacteria. There are some oral virome, viruses in the oral cavity, lactococcus, lactis, niacins, and then we have local inflammation, because all of these will cause local inflammation, will change the situation from the healthy to a disease state of tooth. And then some association, systemic and cancerous disease, and then unhealthy diet, psychological stress, and elevated cortisol. Cortisol is the same thing. Yeah? An unhealthy diet, sugary, this carbohydrate consumption. So again, the 5 stages of disease you already know: healthy gums, gingivitis, periodontitis, advanced periodontitis, and finally the tooth loss. These are the 5 stages of gum disease. Know the signs before it's too late. Again, stage 1, stage 2, stage 3, 4. This is just healthy gingivitis, early, moderate, and advanced, named otherwise as healthy, stage 1, stage 2, stage 3, and advanced. Only remember this advanced is still advanced. The name is same, easy to remember. Other than that, gingivitis, early, periodontitis, and moderate have stage 1, stage 2, 3. The description is same. Here you can see the pockets deepening towards the right side when it's going towards the advanced periodontal disease stage. And these are the extraoral and the X-ray manifestation and changes of the disease state. And then again, we have a comparison of gingivitis and periodontitis in relation to the bacteria involved. In gingivitis, we have actinomyces and bacteroid and fusobacterium, whereas periodontitis, we have more P's, Porphyromonas gingivalis, and then Treponema, and then we have Echinella, Salmonella, Campylobacter. This is the, on the left side, there's a role of plaque in periodontal disease. I want you to read by yourself that how plaque causes chronic inflammatory periodontal disease in adults, up to which stage it is reversible, and when it becomes chronic, it can lead to gingivitis, and gingivitis, if not taken care of, will lead to periodontitis. And then we have toxic damaging bacterial products in plaque. So, okay, let's just quickly go through it. Chronic inflammatory periodontal disease in adults. Gingivitis can come in form of chronic marginal gingivitis. As you remember, we have another classification. We have marginal gingivitis, we had drug-induced, we have pregnancy-induced. So this is marginal gingivitis. Gingivitis can come in the form of this. And then it is a chronic inflammatory condition. It is reversible. This condition is reversible. Which condition? When there is chronic inflammatory condition of gingivitis, marginal gingiva, only the margin of gum tissue is involved. Periodontitis can be chronic or aggressive. It is also chronic inflammatory condition. It's destructive and irreversible. So periodontitis is destructive and irreversible, whereas gingivitis is reversible. Okay, now individually, gingivitis. In patient with gingivitis, there is a plaque formation and bleeding upon probing or brushing, or even brushing. You know the gums are swollen, red, dusky red. They are swollen. The gums are receding. The plaque is formed. Plaque is developed, and it will cause bleeding. Excuse me. Let me just close the windows. So we have gingivitis, where the gums are swollen, dusky red, and plaque is formed, tartar is formed, and then there is bleeding upon touching the gums and probing during the dental probing and even brushing. There is also formation of new blood vessels known as angiogenesis. Of course, when the blood vessels are broken down, new blood vessels are always formed in order to get the inflammatory cells to the site of infection. This is as a response of the inflammation. So what is inflammation? A local response of the tissue, classified by redness, swelling, loss of function, pain, and add angiogenesis, because when there is inflammation, when there is destruction, inflammation, some blood cells will die, will be blocked or destructed, and new cells will form. Okay, so when gingivitis, this gingivitis was reversible. When it progressed into periodontitis, this becomes irreversible, and epithelial adhesion migrates apically towards the root, resulting in gingival recession or gum recession. So periodontitis is irreversible, and this condition, the epithelial adhesion migrates apically towards this side, and this will cause resulting into gingival recession. There is destruction of bone and periodontal ligament. So other than the gum in the gingivitis, now other structures of periodontial tissues are involved. What is done by the plaque? What harm does plaque gives to our teeth? Toxic and damaging bacterial products in plaque. There are millions of bacteria around teeth, and just from their presence, they are producing lots of metabolic products. High levels of acidic, alkaline, and oxidizing materials are being formed by these bacteria in the plaque. Also produce enzymes such as collagenase. Remember yesterday? Gingiberine, collagenases produce toxins such as leukotoxin, toxins which kill white blood cells in the subgingival environment, which damage and inhibit the function of WC. It's easy to remember leukotoxin. Toxin is a toxic substance or harmful substance that kills what? Leuko. Leuko is white blood cells. And then we have bacterial products in plaque. And this is pathogenesis or etiopathogenesis of how plaque gets to a healthy tissue, makes gingivitis, and then it proceeds to form periodontitis. And if we control at this stage, the reversible stage, then we can control the health by removing the plaque by scaling and root planning. But if we don't control it, it progresses to severe gingivitis and periodontitis. Okay, so this ends this slide. Now we quickly go towards the next slide because time is important, right? The topic we start today is oral infections. These oral infections are the infections which are just regarding our oral cavity, basically. So we will focusing all the infections, but we will stay in the oral cavity. So that's why these are known as oral infections. The first one will be viral infection, and then we have bacterial infection, and then important fungal infection. This is very important topic and slide because it's not only the revision of it's not only related to oral infections, viral infection, but it also a revision of the common viruses which cause disease in human. So pay attention. So the oral infection, the viral infections which cause some of the oral infections include herpes simplex virus, varicella zoster virus, Coxsackie virus, especially type A. Why type A? We are discussing the bacteria and the viruses which cause disease in oral cavity. So we will stay in the oral cavity. So type A has some manifestation in the oral cavity, causing some of the viral infections in the oral cavity. That's why type A. And then we have human papillomavirus, HPV. Then measles of the rubella virus, Epstein-Barr virus, EBV. And then we have a retrovirus, HIV, which also causes some oral ulcers and infection. As you already know, the difference between infection and inflammation. Anyone care to revise what is the difference between inflammation and infection? The basic difference.
Sir, between infection and inflammation, sir.
I'm sorry?
Sir, the difference between infection and inflammation, sir.
Yes.
Yes, sir. Sir, I'll explain, sir. Sir, basically, the main difference between infection and inflammation is that we have to understand this, sir. Sir, inflammation is the step that comes after the infection. Sir, firstly, a pathogen will come, it will infect us, it will like do the damage, and sir, the response to the damage is known as the inflammation, sir. The like the different type of cytokines will come, and sir, they will like give that protective response that is known as inflammation, sir. So, sir, the response to the infection is basically the inflammation, sir.
Okay.
Basically, it's the protective.
Okay. Yes. Thank you, Zach. The next person who was saying, continue. Please continue.
Junaid.
Okay, Junaid, continue.
Yes, sir. About the inflammation, basically, it's the protective response mainly. The cytokines and all the things are response in the act of the any foreign agent.
Okay, I understand. Very good. So I have a question for you, Junaid. For example, if you have some cancer cells and the local response of the body is against those cancer cells, won't it be harmful? Because you said that it's always protective. It's protective mechanism of our body.
Yes, sir.
So can inflammation, okay, continue.
Yes, sir, it's a protective response, but sometimes, like in autoimmune disease or like these types of things, it may be
We
harmful
need to
for our
stop it.
body because it negatively affect to our body.
Sir, may I
And
explain?
that's why we have to, okay, yes, continue.
Like so Junaid explained it well, but sir, I just like add a few points. So basically, when like this inflammation sir, comes, so it comes in two types. Sir. It doesn't come in a single. Sir, one is the localized type of inflammation, the other is systemic. So localized is like localized to that area, so that won't cause any like other manifestation. But sir, the issue is when it's the like say it's sort of systemized or say it like spreads. That like so that's where the issue comes in. We'll have different type of systemic. Diseases or systemic complication.
Okay, I understand. Thank you. So what is the systemic form of inflammation known as? Another name of that?
Sir, SIR is systemic inflammatory response syndrome.
Yes, very good. And which can lead to?
Sir, septic shock and sepsis and septic shock.
Perfect. Very good. Very good. Yes. So both of you are very cute with cute answers. So let me revise the question again. In the basic difference between infection and inflammation, both will have a local response to the body, but in infection there is a pathogen involved. But for inflammation, usually maybe there's no pathogen involved, just a response to anybody. But infection, inflammation will also be there. So the difference is in pathogen. That's why these are not called viral inflammation. These are known as infections because we have some pathogen, and these are the pathogens involved in the oral cavity. Thank you for your answers. It was perfect. Okay, so first revise the names. Herpes simplex virus, you already know, we love it. We have type 1, type 2, right? Herpes simplex virus. Then we have varicella zoster. We have varicella zoster. It has two names, one in the childhood, one has manifestation in the adulthood. Yeah, and elders. Coxsackie virus has many types. Type A is our favorite here because we are dealing to the oral cavity. Then we have human papilloma virus, and then we have rubella, measles, part of the family MMR vaccine, measles, mumps, rubella. But this is not rubella. This is not mumps. This is rubiola, measles, German means. And then Epstein-Barr virus, EBV, and retrovirus HIV. On the right side, we see a very common representation how virus comes, replicates in the mucosa, and then causes and stays in some of the ganglion. For example, here it is nerve. Herpes simplex virus type 1 stays dormant in this, and beta cells, and some of the virus stays in the beta cells. These are Epstein-Barr virus and Kaposi sarcoma. Okay, let's revise this. Okay, let's start this. Herpes simplex virus. Please pay attention, everyone. 35 people. Okay, pay attention. Okay, I'm gonna ask you questions. So we have two types of herpes simplex virus commonly: type 1, type 2. The most common viral infection affecting the mouth. This herpes simplex is the most common viral infection which affects the mouth. Although oral infection with herpes simplex type 1 and type 2 has been described, but type 1 remains the dominant pathogen, and type 2 usually causes genital infections. So type 1 herpes, both of them cause oral infections. Type 1 HSV and type 2 HSV, herpes simplex virus, both of them cause oral infection. But if we compare the two, type 1 has more involvement in the oral infection, causing the oral infection, or type 1 virus is the dominant pathogen for causing oral infection as compared to type 2, whereas type 2 is usually more causing the genital infections. Antibodies indicating past infections are present in more than 60% of the adult population. So a lot of people, this is very common, most common viral infection. A lot of your colleagues, family members have this. It usually resolves itself. Maybe no need to doctors if it does not get severe and does not get extended. Usually people don't go for the oral infections, maybe some genital infections, they usually go because they are scared. And then type 1 is more oral than type 2, whereas type 2 is towards the genital regions. There's a difference. Type 1 HSV, type 2. Type 1 commonly called oral herpes. Type 2 commonly called genital herpes. Type 1 causes sores around mouth and lips, fever, blisters, and cold sores. Type 2 causes sores around the genital and rectum. Type 1 can cause some of cases of genital herpes, but most common genital cases are by HSV2. Sores can be found in other locations on the body, but mainly below the waist. Below the waist sores, type 2. Type 1 can also cause genital herpes, but most commonly by HSV2 is genital herpes, because we named it because of the common. This is the common pathogen for that. Can be spread through kissing or sharing objects. So saliva, oral herpes, spreading by saliva, kissing, sharing objects, toothbrushes, glasses, drinks. And then HSV2 spread primarily through sexual contact because it's towards the genital area, right? More towards the genital area. So that's how you remember oral, spread by kissing, saliva, sharing objects, rings. Type 2 is spread by primarily spread by sexual contact. So HSV transmission, again, oral and genital. Oral we have primary and recurrent, and genital we have primary and recurrent. For oral transmission of herpes simplex virus 1 and 2, the transmission through oral, we have a primary, which is asymptomatic, maybe severe. If it is asymptomatic, it's not severe at all. But if it is symptomatic, it's in the severe form. There is no midline or moderation in this disease, right? There is no moderation. It will be in the two extremes, either asymptomatic or it's going to be very severe. In kids, it will cause gingival stomatitis. Gingival stomatitis is important. It causes pharyngitis. Whereas recurrent infections in the oral cavity will be known as herpes labialis, also known as cold sores. These cold sores, remember these cold sores, fever, blisters, or cold sores. These cold sores on the corners of mouth. So if one day your friend says, "Oh, I have a blister here. I think some insect bite me," and it looks like a rash towards the labial area, maybe he has fever. "Oh, I had fever 2 days ago," something like that. So fever followed by rash, HSV, maybe. And the lesions are vesicular. You know what do you mean by vesicular? With a vessel containing some fluid. They are elevated from the skin. And after the vesicle is disrupted, erupted, a superficial ulcer is formed, not so deep ulcer is formed. And maybe you have have read the types of ulcers: rough margin, rounded margin, elevated margin. Remember V shape. So here we have vesicle. Lesions are vesicular, which erupt to form superficial ulcer. So we have HSV, right? Herpes simplex virus 1 and 2. And 1 is very important. And now we look at primary HSV. Can you see here the oral cavity? We have many lesions, rash, and the tongue is usually involved. The tongue is involved. Varies widely in severity, increased with age, often subclinical, asymptomatic in 80%. So maybe it resolved by itself. The patient usually don't come to the hospital or the clinic. But if it's severe, he or she will definitely come. In infancy is often mistakenly attributed to teething. So when the patient is a child, in infant, what is an infant? Less than 1 year, from 1 month to 1 year.